One of the big categories that we get referrals for is for adolescent gynecology, actually. I am not a gynecologist, but I do have training in developmentally appropriate adolescent gynecologic care. So as girls start going through puberty and their periods start coming, and if problems arise, we can help with assessment of that, management of that. We also talk about some of the things that maybe primary care providers are unfamiliar with or uncomfortable with as far as managing birth control and screening for sexually transmitted infections or HIV. We also provide preventive care for HIV to very high-risk teens. So there's kind of a wide range of services. You know, the interesting thing with teenagers as opposed to adults is that the causes of period problems in the early adolescence can vary, often different from things that arise later on in life as adults. So as an adolescent specialist, I'm sort of sensitive to what those issues could be. I also feel very comfortable kind of talking to them about their periods, which can be a very embarrassing topic for some patients. Patients are often more willing to be open or to seek care in an adolescent office because it's not necessarily as intimidating as, for instance, an adult gynecologist's office. So commonly the things that we'll see will be things like painful periods, heavy periods, irregular periods, ovarian cysts. I think the other big topic that we provide care for is birth control counseling. So comprehensive birth control counseling. There's a variety of options available to teens now, including procedures such as IUDs and implants, which we offer. And those can sound scary initially, and so just kind of talking them through what the options are, the benefits, the risks involved, things like that can be very important, because often teens will not seek care or will not talk to a provider about birth control until maybe a year after they become sexually active, and that's concerning. We do a lot of preventive counseling. We talk about risks for instance, sexually transmitted infections, HIV, how to get tested, how to have those conversations with your partner, and then treatment and prevention for those as well. Kind of in a broader circumstance, we talk about preventive measures in a lot of areas. So, nutrition and mental health and just in school, kind of functioning within kind of the teen's everyday life. Do we see that, for instance, with heavy or prolonged periods? People might think, oh my gosh, this is not the way I was told it was going to be. This is not what I'm seeing my friends experience. I must be weird or different, or something's wrong with me. And I can kind of provide the experience and the perspective that, this is actually pretty common in the developing teenager. And so this too can be treated and can be managed, and you're gonna be able to go on with your life. Teenagers are still growing up, right? They're still kind of learning what the world is about. And so they have experience, but they have their own limited amount of experience. And so kind of talking them through their concerns and their worries and kind of helping them realize that this is gonna get better, this will get better, but also validating those concerns. I think one of the things that we often see in teenagers is they feel overlooked, or they feel under-listened to or underappreciated. And so just kind of recognizing that these are your concerns, and we can work together to find a way past them.